Thank you, everyone, for joining us this afternoon and this morning. And can everybody hear me clearly? Thank you. So we will begin with a presentation um, of the initiative. There's a video that has been prepared, and thank you for joining the roundtable. After the video, we'll proceed with remarks from His Excellency. So if we could cue up the video.
The fight against women's cancers has received a major boost that could help save over 5 million lives. Breast and cervical cancers are largely preventable or treatable in richer countries, but are often a death sentence in the rest of the world. Most of these deaths could be avoided if modern prevention measures, cancer screening and treatment were in place. The Islamic Development Bank has joined forces with the International Atomic Energy Agency to mobilize the funding and expertise needed to tackle this issue. Saving Women's Lives from Cancer, a global initiative for breast and cervical cancer control, will bring the international community together to deliver tangible results so that more women will have access to treatment. Between 70 and 90% of breast and cervical cancer patients require radiotherapy, but it is often hard to access. The projects funded by the new initiative will expand breast and cervical cancer control programs, including the upgrade of cancer facilities and the training of cancer care professionals. The bank has committed an initial $10 million US in grant funding, and the partners are now seeking other technical experts and donors to contribute to this important initiative.
Millions of women around the world, but in particular in developing countries, are dying because of cancers that are perfectly treatable and curable in many other places. We have the technologies, we have the science to do that, and we have the resources. It's time to put this together and put an end to this tragedy.
The partnership between the Islamic Development Bank and the International Atomic Energy Agency will widely address cancer prevention, screening, diagnostic and treatment of women in our common member countries. This partnership will contribute to saving the lives of up to 5 million women from breast and cervical cancer over the next decades.
Help us to save lives and join the global effort in fighting women's cancer.
Thank you so much. That video is always so touching. And it's really, an endeavor right now, among difficult times and in COVID-19 more than ever that we need to pay attention to women's cancers. So Your Excellency, I'll turn it over to you to really give us some remarks to the roundtable in terms of, your views and the importance of this initiative for women's cancers.
Thank you. It gives me great pleasure to be here today to discuss our very important partnership with the International Atomic Energy Agency all around saving women's life from cancer. First, let me give you some background on the Islamic Development Bank. We are a multilateral development bank, MDB, working to improve people's lives by promoting social and economics development in 57 member countries across 4 continents and Muslims community worldwide, and touching the lives of 1 in 5 of the world population. ISDB is one of the world's most active MDB and global leaders in Islamic finance, with a AAA rating and operating asset of more than $16 billion and subscribed capital of about $70 billion. We believe all people have the right to live in dignity and prosperity, and that nurturing economic growth is the best route out of poverty. We equip people to drive their own economic and social progress at scale, putting the infrastructure in place to enable them to fulfill their potential. We built collaborative partnership between communities and nations across the public and private sector. We foster innovative and sustainable solutions to the world's greatest development challenges as we work towards the United Nations Sustainable Development Goals as the global cancer burden continues to increase. International organizations, including multilateral development banks, are united in the desire to work together to address this challenge. Developing a new partnership and strengthening the existing partnership is one of my key priorities for the Islamic Development Bank, which is why I am very proud of this important partnership initiative to fight women's cancer, which will contribute to saving over 1 million women's lives from breast cancer and 3.7 million women's lives from cervical cancer over the next decades. The IAEA and ICDP have a long-standing collaboration to support member states of both entities in improving cancer control. Since 2013, the Islamic Development Bank has approved $364 million in grants and loans for cancer control programs in such countries. But there is still more to be done. The need to address women's cancer as a matter of priority and to scale up effective diagnosis and treatment has become pressing, especially with the background of the COVID-19 pandemic. Significant investments involving a broad range of partners in comprehensive cancer control are required and crucial to improving the quality of life of women affected by cancer, while at the same time strengthening national health system. We want to work with other partners to contribute to the global effort to save millions of women's lives from breast and cervical cancer by giving them a fair chance through increased access to prevention, diagnostic, and treatment. Thank you so much.
Thank you, Your Excellency. Thank you so much. Now more than ever, in terms of women's cancers, we've seen a renewed interest, especially with this initiative. The last session we had over 300 viewers from over 40 different organizations and countries. So this is truly a significant effort that both the ISCB and the IAEA have taken together. So thank you for that amazing commitment that I know the world thanks you for. I'd like to turn it over to some remarks from the Director General of the IAEA.
Let me begin by expressing my gratitude and appreciation to Dr. Bandar for his visionary leadership on the issue of women's cancer. I commend the Islamic Development Bank for jointly championing this initiative with us and generously committing essential resources to help save women's lives. Tackling cancer in developing countries is a top priority for the IAEA. This initiative is an ambitious step forward in addressing the inequalities surrounding women's cancers. Breast and cervical cancer are treatable and often curable in industrialized nations. However, in developing countries, both are leading causes of death among women. The fact that 80% of Africans have no access to radiotherapy, which plays a vital role in treatment of breast and cervical cancer, is a scandal. It is simply unacceptable. We must do everything we can to change this. As a gender champion, I am committed to helping to ensure that every woman has a fair chance against cancer, especially the most vulnerable women who live in developing countries. The COVID-19 pandemic has shown that cancer patients are at risk of being left behind. We need to ensure that this does not happen. For many years, the IAEA has assisted developing countries in improving access to radiotherapy and nuclear medicine, thanks to the long-standing and generous support of many of our member states. The IAEA and the Islamic Development Bank have invested significant resources and expertise in the area of cancer, but this is still not enough. More funding is urgently needed. The Saving Women's Lives from Cancer initiative, which Dr. Bandar outlined, will also help support the new World Health Organization global strategy for the elimination of cervical cancer. WHO strategy calls for 90% of women diagnosed with cervical cancer to have access to quality treatment and care, including radiotherapy, by 2030. This is an ambitious target, but I believe it is achievable if all parties, including those of you taking part in this roundtable today, play our part. We are very grateful for our long-standing relationships with existing partners. We need to further strengthen our collaboration with the private sector, foundations, multilateral institutions, including valued partners as the Asian Development Bank, which I am pleased to welcome today. Together, we can demonstrate that smart investments will have long-lasting results for millions of women and girls. The beneficial effects on them, their families, their societies, and their countries' economies will be simply immeasurable. It's up to us. Let's make it happen. Thank you.
Thank you, Your Excellency, and also for those introductory remarks. Again, this is an initiative that really, as we can see from this existing roundtable, brings together both the public and the private sector. And in order to make this initiative not only grow, but impact the amounts of millions of women that are needed, we need this collaboration between the private and public sector, as we're seeing right now in this roundtable. So I'd like to turn it over to Dr. Hayat, who has been not only a champion for this, a visionary and a leader, to give us some remarks in terms of the goals and what this initiative looks forward to accomplishing.
So as you heard from His Excellency, a health sector is a priority, and we're so proud of our partnership with the IAEA and our program called Saving Women Lives from Cancer. So it's designed to aid the development of national and breast cancer. And according to the IAEA, more than 8.6 million women suffer and could die from curable and treatable cancer. And this situation is worsened and more pronounced in low and middle income countries, as you heard before from the previous speakers. And this is, of course, unfair, not acceptable. Knowing the fact the cost of the treatment is relatively low, treatment that could save their lives. Next slide, please. ISDB has been for a long time committed to the global fight against cancer. And as you heard from His Excellency, more than $364 million has been approved by grants, via loans, with the control of fighting against cancer with our partner IAEA in common member countries like Uzbekistan, Senegal, Guinea, Suriname, Djibouti. And we're so more than ever committed to this fighting against cancer, especially with the background of COVID-19. We shouldn't really forget a cause like women cancer, and especially is worsened by the COVID-19. A lot of centers has been closed and suffer, and people not getting the treatment because of the COVID-19. And if you can see from the statistic, it's not right for women who live in Jordan compared with the women who are living in a developed world like America, have less chance of survival. And if you could look here for a breast cancer for Mali, they only have 14% to survive compared of a woman who suffer from a breast cancer in Australia. And the same thing for the cervical cancer, 6 times higher the chance of somebody could die from cervical cancer if in the developing world compared with the developed world. And you can compare here Tunisia with the Korea. So that's why our partnership here with IAA and hopefully with the rest of you is really to change this statistic, to fight this statistic. Should be everybody has the chance, and every single woman and a girl has the right for diagnosis and treatment. Next one, please. And we heard from both the DG and His Excellency, hopefully by this program, we can save more than 5 million women, both suffering from cervical and breast cancer. But for this partnership to really to be more effective, we need to be more creative for source mobilization. We need to be more innovative in finding new solutions for our challenging that we face. Next one, please. And that's why there are key area we're looking for our partnership with people like you as a donor. I really value for you to join us today. We need to really increase the coverage of diagnostic and screening. As you know, the early detection is perform the front line for prevention. We need also to increase the capacity for health services, treatment, accessibility to radiotherapy, hospitals, health trainees to be able to can coverage and provide treatment and healthcare services. And above everything, it's really crucial for us to maintain the quality of the program and the quality of product. Why? Because we need to make sure that the women we are really helping, they are getting the best services from us. Because quality for us is insurance is a top priority through all out the program. Next one, please. You heard from me, His Excellency Dr. Bandar. You know, partnerships is a key strategic priority for ISDB, and to create a new key partner is one of the key pillar of Islamic Development Bank new strategy. But also we need to have the courage to encourage Muslim world to talk about women health, to break down the stigma around it for girls and women. You know, I understand having vaccine for cervical cancer is a taboo in most Muslim countries. So we need to change that, and that's why through this initiative we have the blended finance type of instrument involving 5 Ps, which is coined especially by Dr. Bandar Hajjar. 5 Ps refer to partnership between public sector, private sector, philanthropic organization, and people, civil society. So there are so many opportunities for partnership, and we're looking forward to discuss that through our webinar today and even further. And thank you for your time. And now I hand over to my dear colleague and partner, Ms. Lisa Stevens, who is the director of PACT program at IAA. Over to you, Lisa. Thank you.
Okay, thank you so much. So first, let me welcome our Deputy Director General Mokhtar, who's joining us from IAEA on behalf of the Director General, who sends his regrets. And DDG Mokhtar will be available during the discussion. So I do want to thank you for the opportunity to highlight the important role that IAEA plays as a technical partner in this initiative. Next slide. IAEA is part of the UN family, and we are a science and technology-based organization with specific technical expertise in cancer diagnosis and treatment. Next slide. IAEA has a unique mandate to support our member states to peacefully, safely, and securely use nuclear technology. Specifically in the context of this partnership, that's in the arena of human health. IAEA supports the building of capacity and infrastructure for member states to use radiation for cancer diagnosis and treatment. And we specifically focus on the transfer of technology and expertise to our member states. Next slide. Cervical cancer is the leading cause of cancer death for women in 35 of the 48 countries in sub-Saharan Africa. And in fact, it's the leading cause of mortality for women of reproductive age. Globally, 570,000 women were diagnosed and more than 310,000 died of cervical cancer in just 2018 alone. 88% of new cases and 98% of all deaths occurred in low and middle income countries. Radiotherapy is essential for the effective treatment of many of the most common cancers in low and middle income countries, and this includes breast and cervical cancer. Cancer treatment remains the only life-saving option today that is available, and thus is a key factor to effectively reduce cervical cancer deaths in women and girls. Next slide. As an agency, we have more than 60 years of experience in assisting member states to improve radiation medicine. We have invested our own money, more than 172 million euros, to support cancer-related projects in member states. We currently have around 115 cancer-related projects with our member states, and this involves transferring nuclear technologies to address cancer. Next slide. This initiative supports countries to achieve the Sustainable Development Goals, specifically SDG 1, no poverty, SDG 4, quality education, SDG 5, gender equality, SDG 16, peace, justice, and strong institutions, and SDG 17, partnership for the goals. And this is all under the umbrella of SDG 3, good health and well-being. Next slide. We're looking forward to expanding beyond the generous support of governments and private sectors, donors that we have received to date. When joining this partnership to save women's lives, you have the opportunity to join other global players, including other UN organizations like UNDP, UNICEF, and the World Health Organization, who are working together to improve the health and social welfare of women and girls and improve access to life-saving treatment for breast and cervical cancers. With the recent adoption of the WHO Global Strategy for the Elimination of Cervical Cancer that was mentioned by RDG, we have the opportunity as a partnership to support the 90% access to treatment pillar, and this would be specifically radiotherapy. And together we can make strides in addressing the most common cancer in women globally, breast cancer. Next slide. We've had many supportive partners over the years, and we have made progress. And together with the Islamic Development Bank and under the Saving Women's Lives from Cancer initiative, we have the opportunity to do more with your help. We want to add you to the list of partners and supporters that we have. Next slide. Thank you so much, and I look forward to the discussion.
Thank you so much, Dr. Stevens. And we do see a rich panelist here in terms of discussion. So we will turn it over into a moderated question and answer as we have representation here from not only the private sector, but also the governments. But before we begin, Dr. Stevens and Deputy Director General Mokhtar, this is, as we've discussed many times, such a great initiative, really expanding women's cancers across the globe. So one question, as we're dealing a lot with emerging markets, is how do you see the expansion happening of this initiative, into other emerging markets, especially right now in the time of COVID-19?
Thank you, Joanne, and I definitely would like to hear from DDG Mokhtar, but what I would say is, as I noted, we do have existing 115 cancer-related projects where we're working with our member states on capacity building and training, and also the procurement of equipment that would support the ability to detect and treat cancer. So DDG Mokhtar, are you able to unmute and provide further comment to this?
Thank you, Lisa. Good afternoon, good morning, everyone. Yes, indeed, I think the COVID-19 situation showed us that we have to be aware of the situation and give access to, and help a health professional to give access to diagnosis and treatment to each and every woman everywhere. And we have been doing this even under the COVID-19 situation by providing webinars and technical assistance to each and every professional who have asked our support on how to give services to cancer patients everywhere. Thank you.
Thank you so much. I'd like to turn it over to Ambassador Wolcott. And also, I know we have Ann Gansner, the Acting Deputy Assistant Secretary. So the question for the United States is if you could speak a little bit about what the US government has been doing in terms of women's cancers, in addition to how we believe that, you know, these life-saving benefits of cancer therapy will protect, you know, against some of the deadly issues that women are facing.
Thank you very much. Can you hear me okay?
Yes, thank you.
Well, the bad news is that Des Ganser was unable to connect, so you're going to get twice as much of me. So I will try to answer both parts of the question. First, I want to thank Dr. Cindy and Dr. Stevens for their very insightful presentations on saving women's lives from cancer initiative. I appreciate the work both of you and your teams have put into this partnership and initiative, which has the potential to benefit millions of women around the world. As you know, the United States has long been a supporter of PACT and was proud to pledge $760,000 to the Women's Cancer Initiative in 2019 at the Scientific Forum. This is on top of the millions of dollars the United States has allocated to various technical cooperation projects focusing on cancer treatment and control. The US supports the IAEA's efforts to seek new funding streams and to develop partnerships that will expand the impact of the IAEA around the world, which is why it's encouraging to see so many participants in this virtual meeting from the private and nonprofit sectors. The United States helped forge one of these partnerships, and that's the one with American company Varian Medical Systems. Varian provided a LINAC to the IAEA free of cost for 10 years to be used at the IAEA's dosimetry lab in Cybersdorf. For our part, the United States is providing $1.25 million to cover the service and maintenance for costs of the LINAC. We know that it's the low and middle income countries that are going to need the most help with cancer treatments, and demand for cancer treatments in these countries is expected to grow. Right now, only about 5% of what is spent on cancer treatment globally is aimed at low and middle income countries, particularly those where health systems are already stressed or struggling to meet the demand for the growing number of patients with cancer. As I've said many times, and I'm happy to repeat here, the United States has a tremendous amount of trust and faith in the ability of the IAEA to efficiently and effectively carry out its projects. That's why we are so supportive of the IAEA's work on cancer diagnosis, treatment, and prevention, especially within low and middle income countries. The IAEA has the technical capabilities to address their needs. And on the second part of your question, ensuring that radiation therapy is both safe and effective depends on expertise in dosimetry and health physics to find the proper radiation dose and deliver it to the right part of the patient's body. I've heard Dr. Mokhtar talk about this many times. That is why the IAEA's assistance in radiation therapy goes hand in hand with assistance in radiation safety and nuclear and radiological security against possible malicious acts. It's also a perfect example of the more general fact that the ability to take advantage of peaceful uses of nuclear energy, science, and technology is tied to the responsibility to do so safely, securely, and without contributing to military uses. The IAEA has been a key mechanism to deliver this expertise and these benefits to member states, while simultaneously helping member states ensure the best practices in nuclear safety and nuclear security are applied in conjunction with this technology. We support the IAEA's role in all of these aspects. The case of radiation therapy illustrates the broader point that it is a mistake to think of efforts to promote and to regulate the peaceful uses of nuclear energy as somehow in competition with one another. Quite simply, you can't have one without the other. And efforts to apply high standards of nuclear safety, security, safeguards, and non-proliferation are not meant to restrict those peaceful uses, but to enable their fullest possible application as envisioned by the Nuclear Non-Proliferation Treaty. Thank you very much for letting me participate in your roundtable today.
Thank you so much, Ambassador. And I think, you know, the wonderful partnerships that we're seeing between the public and private sector, we will look to those to really incorporate into this initiative, as Dr. Hayat was saying earlier, you know, in terms of the blended financing, you know, that's really necessary to take this initiative off the ground. So thank you so much, and to Dr. Stevens as well. I'd like to turn it over to a question for the permanent mission of Sweden. And I know that you just joined us, Mr. Loading. So I just wanted to make sure we can hear you okay. Can you hear us?
Yes, can you hear me?
Yes, perfect. Thank you so much. So our question is that, you know, Sweden has had extensive experience in mobilizing cross-sectoral actors such as academics and industry to effectively tackle global development challenges. Given the focus of Sweden's feminist foreign policy on gender equality and women's rights, how do you see your country and contributing to this initiative? And an initiative that, you know, leverages both the importance of expertise in bringing innovation, expanding partnerships, and also blended financing to achieve this joint goal of improving health outcomes for women. So, sorry, long question, but thank you so much for participating.
Thank you so much, Joanne, and thank you for your question. And let me first of all congratulate all the previous speakers for their excellent contributions. Ambassador Kumlin Granit would have liked to participate in this event, but unfortunately she was detained elsewhere. And I would also like to thank the Islamic Development Bank and the IEA very much for inviting Sweden to this important virtual roundtable discussion. Sweden is very pleased to have joined forces with the agency and with the ISDB as a partner and a contributor to the Saving Women's Lives from Cancer initiative. This program illustrates several of Sweden's foreign policy priorities, and I would like to first of all give you 3 examples. Firstly, as you, Joanne, pointed out correctly, Sweden pursues a feminist foreign policy. 6 years ago, we were the first country to do so, and I'm pleased that in the intervening years, several other states have launched similar policies. Secondly, sexual and reproductive health and rights belongs to the very highest priorities within the framework of Sweden's development assistance in the health sector. Swedish SIDA is working very closely with all of the recipient countries of Swedish support in the health sector specifically in order to promote SRHR. Thirdly, Sweden, as the rest of the European Union, would like to see the agency's development pillar closely aligned with the objectives set up in the 2030 agenda. This vital link was underlined by both Her Highness Crown Princess Victoria and Foreign Minister Margot Wallström during the IEA high-level meeting on Agenda 2030 a couple of years ago. The Saving Women's Lives from Cancer initiative clearly addresses, as has been said before here, both Sustainable Development Goal 3 on good health and well-being and Goal 5 on gender equality. And it is against that background that I am pleased to be able to confirm today that the Swedish government service formally decided a week ago to provide a further extra budgetary contribution of the equivalent of $342,000 to the IEA through the Peaceful Use Initiative for the purpose of the Saving Women's Lives from Cancer initiative. So I'm happy to announce that. Sweden's feminist foreign policy is, of course, not limited to the political level, but it also includes, as you said, Joanne, both academia and industry. Sweden's headquarters some of the leading actors in oncology, such as the private sector company Elekta. Electa decided to support the ISDB IEA initiative to expand women's and girls' access to preventive care and treatment very early on. It has since created a clinical training program, which it has made available to the IEA in its efforts to educate practitioners in treating cancers that affect women, particularly in low and middle income countries. In February this year, before the outbreak of the COVID crisis, the Swedish Permanent Mission and Electa joined forces with the IEA and arranged a panel discussion on the occasion of the World Cancer Day here in Vienna. The panel discussion was opened by Director General Grossi and Ambassador Kumlin Granit. Over 100 representatives from academia, the industry, and the public sector, including UN agencies such as the UNAIDS and UNICEF, gathered to discuss innovations within women cancer care. This is a great example of how cooperation between the government, industry, and academia together can target the challenge that non-communicable diseases present to women and girls around the world. It was also an excellent example of the type of public partnerships that the agency, and not least DG Grossi himself, are promoting. So in conclusion, and in actually answering your question, the initiative Saving Women's Lives from Cancer has offered for us a great opportunity, in fact, to demonstrate, as I mentioned, several of our highest priorities in our foreign policy. And I would encourage more partners to join in this crucial initiative, as it would provide a concrete instrument in support of women's health and demonstrating impact through tangible results and long-lasting changes for women and adolescent girls. And I thank you.
Thank you so much. And that's such an exciting announcement. I think hopefully other partners here, will be mobilized by that. So thank you so much. Sorry, I think I was muted. Can everybody hear me? Thanks. In describing a lot of Sweden's work is also, I know Sweden has done some work in blended financing. And this initiative, I think, is so revolutionary and will be transformative globally because of its, focus from a financing perspective on blended financing. So I'd like His Excellency, if you could just comment on the 5 Ps initiative, really where the 5 Ps came from, which is really truly instrumental in how we scale this globally.
Thank you so much. First of all, the challenges facing the world as in general and the developing countries in particular is huge and beyond the capacity of any individual institution to address these challenges. So partnership here is very important, but we used to speak about the partnership between public and private sector. But in fact, the NGOs and non-profit organizations, universities, and research centers play a crucial role, in fact, in addressing all these issues, development issues, including health, education, climate change, and so on. So for these reasons, I think it is very important to engage the private, public people with robust partnerships, so we'll have 5 Ps instead of 3 Ps. Through our work here, we will improve, in fact, gender equality and basic human rights and access to health service, as well as encouraging innovation, increase research, development spending. These are very important for these 5 Ps. In addition to that, we want really to encourage all the people to be part of the development process in our member countries. Once they feel that they are part of this process, they are part of this initiative, they will have the ownership and they will be encouraged and attracted to contribute more to this, especially when we talk about health and education, particularly these two sectors. And now we will see in almost all our member countries, when you review the Vision 2030, you will find in this plan that there is this space, they allocate first space for the role of NGOs and non-profit organizations. So development is not just the private and public sectors, it is more and beyond than that. And I would like to thank also, take this opportunity on the behalf of the Islamic Development Bank and thank you all for attending this virtual meetings today, and special thanks to our partner IAEA for this important and great initiative.
Thank you so much. Thank you so much, Your Excellency. And now in terms of the remarks from other governments, I'd like to turn it over to Frédéric from the government of France. I know France has been a long time supporter of IAEA's cancer control activities and is one of the key governments in the initiative. How important is the initiative to France, and can you speak more about the government's drive to support efforts for finding innovative models of financing and partnership?
Good afternoon, and thank you very much for the invitation for this webinar. First of all, I would like to convey to you the apologies of His Excellency Ambassador Xavier Sticker, who would have loved to attend this event, but who is currently enjoying well-deserved holidays with his family. However, he asked me to convey to you his deepest sympathy and strong support. I'm very pleased to be with you today and attend to this event with all these distinguished participants. Thank you very much to Dr. Cindy and to Dr. Lisa Stevens for this very comprehensive presentation. As you know, and as you say, Johan, France is one of the very first supporters of the initiative Saving Women's Lives from Cancer. Therefore, we would like to salute all the efforts you have made, Lisa, to develop this project. I perfectly remember our first meeting with also Anya when you come to our mission 1 year ago. You presented us your project, and our ambassador was immediately seduced and convinced by the initiative. Also by the necessity of supporting and by finding new financing model and funding strategies. Since the first meeting, you, IAEA, you have accomplished a very spectacular work, bringing new partners at your side. We will therefore thank the Islamic Development Bank for trusting and joining the initiative. Thank you, President Adjar. Such a partnership offers new perspective to support the important issue of increasing access to more efficient diagnostic in low and middle income countries. This will make a tangible difference in the life of women affected by breast and cervical cancer, as well as in the life of their families. On a more general perspective, the partnership between the IAEA and the ISDB is a model we should follow and build on. To answer to your question, this is why we have launched a review to identify French non-traditional counterparts, which will also be interested in contributing to this initiative. Xavier Sticker is himself very involved on that. This is a part of a new global approach that we try to develop on our side, which also encompasses a reflection on win-win financing model to build up and to improve its system on a long term and on a sustainable basis. Again, you can count on French support. Thank you very much.
Thank you so much. Thank you. In terms of the announcements from the different governments, I'd like to turn it over now to the private sector, specifically the head of Merck for Mothers, Marianne. I know Merck for Mothers has been involved in a lot of different public-private partnerships. And Marianne, you've been a visionary in leading some of these also blended financing partnerships that not a lot of private sector partners know well, but I know that Merck for Mothers knows very well and has done a lot of partnerships with development finance corporations. So you seem like a perfect fit for some of these discussions. So Marianne, I'd like to turn it over to you to comment on this initiative and also some of the work that Merck has been doing.
Yeah. So thank you, Joanne. Can everyone hear me?
Yes.
Perfect. And thank you so much for the invitation to join this esteemed group and such an important conversation. As Joanne mentioned, I'm the lead of Merck for Mothers, which is Merck's $500 million commitment to help end preventable maternal deaths worldwide. And like the Saving Women from Cancer initiative, we are also looking at that SDG 2030 goal and how we meet it. Joanne mentioned that a big strategic approach of ours is how we really bring together the contributions that the private sector can make towards meeting these global health goals and addressing these global health challenges. And we think about public-private partnerships in a number of different ways. One is how can we bring private sector capital to bear, whether it's through different innovative financing mechanisms. And our experience to date there shows that all of the sweat equity that everybody else, everybody here on this video conference is putting into this effort is so needed, because this really is a new frontier of how we bring all of the resources we need to bring to the table in order to save women's lives. And our learnings from that experience is that it does take that sweat equity. And there are lots of different types of financing partnerships that are needed. I know another esteemed member of the roundtable mentioned the role of innovation. And we know that in order to actually move from innovation to impact, we not only need to invest in new technologies, but we also need to figure out a way for them to be deployed and integrated into healthcare delivery systems and replicated at scale, so that those millions of women lives that we want to save, can be saved. We know through working on maternal health issues that period of time during pregnancy and childbirth, when women are interfacing with the health system, is a critical time, to link them to broader healthcare goals and information about preventive health, especially in oncology. And we think about public-private partnerships as well in the care delivery space. I believe another esteemed member of the roundtable also mentioned the important place quality and quality assurance plays in this work. And that's exactly what we've been seeing. Without also a focus on quality around the implementation and the work of these partnerships, we don't get the results that we're looking for. So just to end, Joanne, by saying I'm so excited you invited me to be part of this discussion. These are the critical issues that are broadly relevant for all aspects of global health challenges, and in particular women's health. And this issue that we need to bring more attention to, saving women's lives from cancer. And the public-private partnerships that are being catalyzed here in this video conference are such an important step. They are a first step, and it's great to see that the collaboration is so strong. So thank you.
Thank you, Marianne, as always. You've been such a leader in these initiatives, and I know also in terms of empowering women, and so we will look forward to follow up with you as well. I'd like to turn it over to another private sector from the Medtronic Foundation, Jessica. I know as a foundation, Medtronic has prioritized equity in their donor activities. How do you see paths forward to mobilize efforts to create true equity in both the delivery of care and treatment, as Marianne was just speaking about, but also in terms of what Dr. Hyatt and Dr. Stevens spoke about in terms of research and innovation, and also in education as well.
Great. Well, thank you, Joanne. Can you hear me okay? Great. Well, it's such an honor and a pleasure to be with you all today. And I want to thank you for the opportunity, and thank you to be in this esteemed company on the panel, and to congratulate you on an amazing initiative. I represent Medtronic Foundation, which is the philanthropic arm of Medtronic Corporation, one of the largest medical technology companies in the world. So it's a great pleasure for me to see the potential on the private sector side. I do personally have a history working in the federal government for the United States and the President's Emergency Plan for AIDS Relief. And back in 2012, helped support the launch of Pink Ribbon, Red Ribbon for many of these same initiatives. So it just warmed my heart so much to hear all of the amazing work happening, and really congratulate you on taking this forward. And really also congratulate you on the focus on equity. I think that was from Dr. Cindy's presentation and Dr. Stevens, such an important focus on the disparities that women are facing in developing economies. And I think for us at the foundation, we've always had a focus on underserved populations, which is defined essentially by local definitions of poverty for the foundation. Since George Floyd's murder here in the United States, and this sort of awakening that we've all had, I think we've wanted to get much sharper about how our programmatic initiatives are focused on addressing true disparities, and that we can quantify those in very meaningful ways. And that targeting then also allows us to understand how the financing and the resources should flow. And I can say from the perspective of our foundation, where we've been focused more on chronic conditions like diabetes and cardiovascular disease, as well as what to do in the case of a time-critical event like a heart attack and a stroke. We believe that having a very clear focus, as this initiative does, on the outcomes and the disparities that we're addressing through our programs is very critical, and that focus helps drive very strong programmatic initiatives on the ground. At the same time, it's difficult to have a vertical focus and to be working within horizontal systems where the whole system needs to be strengthened. And sometimes we can lose sight of, particularly in that continuum from screening to treatment to quality assurance, lose sight of how to strengthen the whole system or the competing priorities that we have within systems as we have a vertical focus. And I believe that's potentially where we can continue the dialogue in support of the work and the initiative that you're doing, is as we take our focus in diabetes and its disproportionate impact on women, as we take our focus on hypertension and how that's managed, and how that's managed in an environment in which COVID is disrupting services and creating a digital divide in how people are accessing care. How can we jointly, with our sort of intended focuses on specific cancer outcomes or cardiovascular outcomes or maternal and child health outcomes, ensure that we're working together to strengthen the overall system of care, and to ensure that that system of care is targeted where the resources are most needed, where we're seeing the greatest disparities. So I'll leave it there, Joanne, but happy to discuss more. Thank you.
Thank you, Jessica, and thanks for joining us, especially, given your expertise in launching some of these blended partnerships in the past. We will definitely, be calling upon you as we move some of these efforts forward. So thank you. I'd like to turn it over to, the implementers, really, Sahara Breast Cancer Association. In terms of, we've heard from the governments, we've heard from the private sector, and, the associations are really working with the women on the ground. So Dr. Lee, your association has helped develop comprehensive cancer control in Saudi Arabia, developing a comprehensive, holistic control plan that requires the involvement of various sectors, like the ones we just heard from earlier, that go beyond just, public care. From your experience, what is the best way to leverage on the expertise of other actors, such as the ones you have here in the roundtable, particularly private sector, to support robust cancer control plans?
Hello, everybody. Thank you for this invitation, and I'd like to thank the Islamic Development Bank and the IEA for this initiative, and the organizer for the Fighting Zahra Association, Breast Cancer Association, to give its views. Zahra Association is focused actually on breast cancer in Saudi Arabia. Knowing that breast cancer is #1 in incidence and also in mortality. Unfortunately, we saw that more than 50% of our patients presented an advanced disease, that's stage 3 and 4. So the focus of Zahra was not only on providing social, psychological, and economical support to patients during their treatment journey, but also goes beyond that to cover important aspects, that's prevention, screening, and early detection. Zahra was managed to be a member in the National Cancer Center for the Saudi Arabia. By being a member in that organization, and this is where most of the cancer control plans are developed and also monitored. So we were able to present the patient's voice and perspective at national level. The contribution of Zahra went also to trying to bridge the gap in healthcare services provided by the government and the private sector. We were able to develop several memorandum MOUs and partnerships with mainly the private sectors, the commercial banks, the big companies in the country, and provide the support to the national program. I'll give 2 examples. The first one, Zahra supported the National Cancer Control, National Screening Program by a good number of fixed and mobile mammogram machines, and that's what was due, by getting some fund from big companies in the country, and that was also supported the national program, and now we can see a good program. It's not yet complete, but we hope it's going to cover the entire kingdom. The other example is we know that from the study of the age of our patients in the country, we've noticed that good number of patients, more than 40% of patients, are below the age of 40, where mammogram is not a tool of diagnosis or even screening. So we also came up with another initiative, and also was supported by a big oil company in the country, and we addressed the importance of screening, cancer genetic screening, mainly for high-risk groups. So these 2 initiatives were like a partnership between the private companies with the NGOs, and serving all of them, serving the national program. So the the take-home message actually is to involve your partnership. If you want to, if you are running after a successful program at national level, you should involve your partners in the design and also in the implementation. So as I mentioned, these are mainly the 2 initiatives that Zahra took, and it had some impact in the country, at the country level, and I believe this can be expanded. Again, I'm thankful for giving me this opportunity, and also and Zahra looking forward to join the Noble Initiative by ISDB and IEA towards saving more women's lives. Thank you.
Thank you so much. Thanks a lot. And one of the important things is, we're looking and starting to form some of those dynamic, public-private conversations. And we see this as a journey to many conversations, and also the, follow-up in terms of the different participants really generating different thoughts and coming together into this initiative. So thank you. I'd like to turn it over to Dr. John from Electa. I know that Electa is one of the first partners to the initiative. And I'd like to ask you how critical it is for you and your company to harness the technology and innovation of the private sector to work with other governments, civil society, and multilateral organizations towards a shared objective for improving not only the health of women and girls, but particularly considering SDG 17 in terms of partnerships for those goals.
Yeah, thank you, Joanne. And first of all, thank you to IAEA and the Islamic Development Bank for setting this up and for allowing us to participate. I've been listening to a lot of the great comments that have been made, and it's all about partnerships. Partnerships from diagnosis to treatment. I think it was mentioned as well. You don't want to be diagnosed and there's no treatment available. But also the partnerships on innovation versus needs. We talked about quality and solution of qualities. The best solution is that solution that fits the purpose for that particular geography or disease. And that needs partnerships with governments, but also with the users. And for Electa, it is very important that the partnership workflow, if you will, between governments, NGOs to the end users is a steady flow. I always say that money is, of course, a prerequisite, but money needs to be activated. Because only with activated money, meaning it's solutions that are used and usable for that purpose, then it will work. And when I look at what you've been setting up, I think we have that good start, but we need to nurture that. And for Electa, it's important we have Habib Naim, our Executive Vice President for the Emerging Markets, to show how important it is. He's also on this roundtable. It's important to have IAEA, the Islamic Development Bank, and the other organizations to work with us in good faith. In good faith to ensure that we give the best solutions, and again, best meaning also maybe from a financial perspective, the best solutions to the women who are in desperate need of this. And the head of brachytherapy, cervical cancer is a key element for that. We are developing solutions that are also fit for these countries that have late diagnosis. It was already mentioned that that for cervical cancer in the developed countries, there are good treatment options. But we should also not forget that in the countries we're talking about, there's late diagnosis, which means you have other solutions, coming back to what I said about best solutions that are needed. We need to make sure that people are trained, and it came up as well, to use it. It doesn't make sense to develop these solutions, to activate the money, if the people are not activated for using it. And that is what we're trying to do as well. If I look at Brachy, we have the Brachy Academy, where we bring key opinion leaders in contact with the developing markets, with the emerging markets, to train people, but there's much more to do. And for us, this partnership, the SDG 17 goal is much more than finding markets. It's finding solutions. It's high on my agenda, it's high on Habib's agenda and on Electa's agenda to ensure that there's an even distribution of the solutions, but also of the possibilities for training and educations to women who are in need of that. So answering your question, for us, it's important to have that connection to ensure that you hear more than we hear as a private company, to have that open flow of information based on the trust that we all want to do the same, and that is to give treatment for these women. With that, I have one last remark, which is we talk a lot about curative. I still think there's a lot of palliative treatment and a lot of benefit to be held for palliative treatment. And radiotherapy is a key element that could deliver palliative treatment. And even if there are no days to be added to life, then you can add life to those days of those women. And we should not forget that. It's not only about curative, it's also palliative. Thanks.
Thank you so much. Thanks again. And I know we're a little bit over time, so thank you to all the roundtable participants for really staying on with us. We just have a couple more questions, but thank you for your commitment. We have a speaker from Sahak Kahani. You know, this is really, I know that the ISCB has also been instrumental in the growth of Sahak Kahani. And so I'd like to ask a question in terms of, you know, establishing women's access to critical care services in Pakistan. How do you see ways in which women may be mobilized to deliver and receive both critical care and ensure sustainability of these efforts? Because sustainability is what will be so key, as mentioned earlier by His Excellency, with the 5 Ps and the blended financing mechanism that's required to both work with private sector partners as well as governments. I don't know if you're having technical issues. Can you hear us?
Joanne, Dr. Safar did indicate that she was having difficulty with her audio and video due to a storm in Pakistan, that she would try to remain on, but if not, just to move on.
Okay. Well, thank you so much for that update. I think I just checking in terms of, you know, also being getting all our panelists in from the UBS Foundation.
UBS Foundation, unfortunately, Marissa had a prior commitment. She had to leave, unfortunately, early. So that leaves us with the representatives from Direct Aid.
Okay, thank you so much for that update. So in terms of Direct Aid as an implementer, we heard from one of the other implementers, and I know primarily doing work in Africa. So if you can comment in terms of your work that you see linked to this initiative.
Hi, thank you so much for having us in this webinar. This is Hala Al-Humaydi, Director of the External Relations at Direct Aid Society. Adding to what you have just said, Direct Aid Society works in 30 African countries as well as Yemen. We actually have field offices in that. I'm sorry, the video is not working with me. Can you hear me?
We can hear you just great. So we can't see you, but we can hear your words so much.
Yes, I'm sorry for that. Moving on, I would like to thank all the participants on their amazing work regarding women's health, primarily on cervical cancer. Furthermore, I just have a question to Medtronic. Being the medical device company, one of the largest actually device companies in the world, operating in 150 countries, I believe. Us being an INGO and implementer and doing a lot of work, partnering with ISDB and other organizations around the world, I was wondering if we can, like, do they have the initiative in partnering with INGOs, with other INGOs, and providing them with the medical equipment in order to help the needy in those countries? That's my question.
Thank you. Hi, this is Jessica. I can attempt to answer that. And thank you so much for the question. I'm very happy to connect offline and have a longer discussion. The short answer is that we have limited financing for global partnerships to INGOs, but in general, it's not very common for us to fund INGOs. We have tended to fund local organizations more commonly that are directly implementing. But that doesn't rule it out. There also is quite a bit of philanthropy that the business units themselves from the company do for product donation. which is handled separately from the grant initiatives that the foundation runs. So I'm very happy to discuss more of that with you offline if it's of interest and we can make connections.
Thank you so much, Jessica. Appreciate that. Thank you.
Thank you so much. And I know some of our panelists need to leave. So I'd like to turn it over to Dr. Hayat and Dr. Stevens for some concluding remarks along with His Excellency. Dr. Hayat, over to you.
Thank you very much. I'm so pleased to see the commitment of government. Thank you, USA, Sweden, France, and also the private sector, Merck, Marianne, and also Jessica and Electra, and also First Aid. And we'd love to hear from our winners of Transform Fund from Sahana, from Pakistan. Unfortunately, we couldn't hear. So I just want to let you know that it's very crucial for us to come with innovative idea, and that's why we set up to be focused and just to echo all our today panelists. We set up call for innovation, especially for diagnostic and capacity building for breast and cervical cancer, and we received amazing proposals from the developed and also developed and developing country, and we will be announcing the 4 winners around the annual meeting next month, and hopefully we physically will be there and to announce the winners. Why? Because it's very important, as you mentioned, especially Marianne, to see the power innovation reaching the community, and that's exactly what ISDB doing with the Transform Fund and with innovation and with Triton this academy, to be able to see the idea from the start, and we give all the support and knowledge, all the entrepreneurship ecosystem for to reach. And this is one part of the equation. And exactly when our partnership with the private sector and an NGO, government is crucial because you are the front line of making decision and making policy and making manual script for the rest of the state to follow. And that's exactly the Dr. Badr Hajjar 5 Ps what it stands for. We cannot leave anybody behind. We need to, all of us. So every 50 seconds, we lose a woman for breast cancer, and every 90 seconds, we lose a woman for cervical cancer. Losing women is affecting society, family, community. And we are here, we really urge you to join us in this amazing initiative and to have the pledge, inshallah, in Vienna next month. I just want to mention 1 minute. When Dr. Bandar been informed that the top 3 countries having the highest mortality of women for breast and cervical cancer in our developing world, he contacted me and he said, this is not fair, and we need to do something about it, especially the cost of the vaccination for cervical cancer costs about $10. So he put all his effort and commitment, and thank you to him for having this. And since then I contacted IAA, and after 4 months we launched with him with the former DG in Vienna last year. And so much to do and so much to accomplish, but I really thank you all for your here, because you are part of this saving women is a chance, giving them a chance to survive, give them a chance to grow and see the future, especially young girls, and we are capable of making a difference. Education, as His Excellency mentioned, awareness and treatment is a key thing. And thank you. I'm looking for all of you to carry the dialogue and to see you inshallah in Vienna for the announcement, and also for our anniversary in September in Vienna. Thank you.
Thank you, Dr. Hayat, and Your Excellency. Thank you for staying for the whole session. Just turning it over to you for some concluding remarks.
Thank you so much. I just want to emphasize that development means improving the life of people and give people hope and empower them and make impact on the ground. Development goes beyond building roads and airport and port. It is the central role of development is human being. So once we really succeed to save the life of the people and empower the people. That's it. This is what we are talking about. Thank you so much once again.
Thank you, Your Excellency. And Deputy Director Mokhtar. Oh, we can't hear you.
Can you? Okay, good.
Yeah, we can hear you.
Okay. Okay. Oh, well, let me first thank the Islamic Development Bank under the leadership of Dr. Bandar for teaming up with us on this joint venture, and thanks to all of you for joining us today in this event. The fact that we are all here today shows our commitment to change the situation, especially in middle and low-income countries. Being a woman from a developing country, this initiative gives me hope that together we can reach the goal of giving the right to access to cancer treatment to every woman everywhere. And we at the IAEA, we stand ready to provide technical support to all member states to set their infrastructure and capabilities to fight cancer among women in efficient and safe manner. I look forward to more partners joining IAEA and SDB in this endeavor, and together I believe we can do more and can do better. Thank you.
Thank you so much. Dr. Stevens?
Thank you. I don't think I can top Najat's comments, so I will just say thank you to all the interventions today. Thank you to Dr. Hyatt, Dr. Bandar, and to DDG Mokhtar for participating and contributing to this, and I look forward to others joining us in this endeavor.
Thank you so much to everyone, and we'll be following up very closely with a lot of the partners that participated today for the first time and have been socialized to this initiative. You know, endeavor that we look forward to working with you hand in hand.
Thank you to you for your coordination. Thank you.
Thank you. Thanks to everyone.
Well done.
Thank you.
Yeah.